The World Health Organization defines mental health as a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. It is fundamental to our collective and individual ability as humans to think, emote, interact with each other, earn a living, and enjoy life. It acknowledges that it is an essential component of health and is more than just the absence of mental disorders or disabilities. It also addresses that it is influenced by numerous biological, psychosocial, and socioeconomic factors. Chronically high levels of anxiety and stress are often characteristic of poor mental health, and unfortunately also of the university student experience. A national survey conducted by the Higher Education Research Institute in 2015 indicated that self-reported stress levels of college freshmen are at a 25-year high, while their self-appraisals of emotional stability, resilience, and coping strategies to manage their stress are at an all-time low. Often stemming from various academic, social, and personal factors, this elevated stress and anxiety can lead to distress and cause students to feel overwhelmed. In many post-secondary institutions and university campuses across North America, there have been unique programs implemented using dogs for therapeutic purposes in order to alleviate the aforementioned feelings of stress and anxiety. For instance, Yale Law School infamously and successfully implemented a pilot therapy dog program in March 2011, introducing its students to Monty, who went on to become a familiar face at the Lillian Goldman Law Library for many years afterwards. The primary intention was to help relieve student stress levels, as well as to create a more positive and supportive learning and living atmosphere. Since 2011, countless schools across North America have followed their footsteps and have implemented similar therapy dog programs, McMaster University included. McMaster hosts various therapy dog sessions throughout the year, such as the Housing and Conference Services, the Faculty of Social Sciences PAwS program, and the Dogs at Mac program. How long have you been involved in therapy dog training?
Well, the therapy dog visits I was involved with for 4 years with Liam. I'm involved currently with coordinating the Dogs at Mac library dog, but being active in it was 4 years.
How did you come upon therapy dog training and the use of therapy dogs in different settings?
When I started here at Mac, there was dog visits held through social sciences, and I went to one and thought, hey, my dog could do this, my dog Liam. So I approached the program, brought Liam in, and the university implemented a requirement that they be certified therapy dogs, which we've done through the Humane Society here in Hamilton, Burlington. And then we made the decision to have Liam be a resident library dog, so that students would visit him in the library specifically.
Have you witnessed or experienced any potential drawbacks of therapy dogs?
I haven't necessarily witnessed it, but we were very aware that some people have allergies, and there's some cultural differences to perceptions of animals.
What settings have you worked in with therapy dogs?
Personally, my settings have been here in the library and on the university campus. So Liam's visits for 4 years were every second week. He'd be here for the whole day, but he'd have 3 visits in a day at each different library.
Could you share any personal experiences that you have heard from students about their visits with Liam?
Oh, yeah, absolutely. Students, it would bring up that they missed their dogs at home. So it made them sort of sad, but it made them happy to have their hands on a dog. Students would say, I've got an exam and this helps me go into it in a good mindset, or I've just come out of an exam and I feel better now. Students would cry from joy. Yeah, it was very emotional. And they would sit and talk to each other. So they would come with people, or they'd be there with people they didn't know, and they would sit and have conversations about the dog, but also about classes and exams and things like that. So it really sort of built a little community at that moment of students that didn't know each other. But yeah, I mean, I never ever had any negative feedback from a student. It was always how gratifying it was, how thankful they were that there was a dog, how happy it made them.
Animal-assisted therapy is a complementary medical intervention to assist in the reduction of symptoms associated with anxiety and stress. Research has indicated that interacting with therapy dogs, even for brief periods of time, can reduce physiological symptoms of stress. These include lowering heart rate and blood pressure, increasing levels of oxytocin and endorphins, and reducing levels of stress hormones cortisol, epinephrine, and norepinephrine. Therapy dog sessions have also been shown to reduce the psychological components of elevated stress and anxiety. Short interactions with therapy dogs have demonstrated benefits including reducing self-reported perceived stress levels, depression, homesickness, and feelings of isolation, all of which are increasingly common to many individuals in university. Immediate psychological benefits from attending a therapy dog session may additionally stem from the distraction the session offers from other life stressors. Overall, hosting therapy dog sessions is an increasingly popular trend across university campuses throughout North America, as attending these sessions offers a cost-effective, quick, and easily accessible complementary medical intervention for many university students experiencing elevated levels of stress and anxiety. While there remains a great deal of further research to be conducted on the efficacy of the relationship between therapy dogs and mental health, this therapeutic intervention offers promise in supporting a variety of populations.